So we're going to talk about how to write a manuscript. These are the steps that I have been using for my first paper was published in 1998, so 27 years ago. So these are the steps that I use. And I wrote them down in a Word document and PDF that has been shared all around the world. So I can send that to you. And there's some other documents that I find useful that I can send to you. And that first paper that I wrote was uh, on a parasite called strongyloides, and it was a short report. And I submitted it with my supervisor to a really good Journal of Infectious Diseases. And if you can imagine, it came back when they asked for no revisions. It got accepted as is 27 years ago, but since then it's been downhill with lots of rejections and lots of revisions. Um, and writing manuscripts, um, it is a learned skill. Writing is a learned skill. So you might not be great at it now, but you can learn how to do it. And it just takes like practice, and you just have to sit down and do the writing. And as you do it, and the more you read, and then you work on, you do get better over time. And I'm really going to be talking about how to write a health research manuscript. Okay. Because we do health research. And here are a couple of excellent resources. So, we can circulate these and also put them up on Basecamp. Um, I really like the International Committee of Medical Journal Editors. They have actually um, a document, a paper which summarizes what is expected um, to be in the different sections that are expected in a health or medical research paper. And so really, it's a bit like a formula. They literally lay out that you need the abstract and what's in it, the introduction and what should be in the introduction, then the methods, what should be in that, then the results, then the discussion. So that's something that we can circulate. Another resource that you might not know about, and you could even check out this website right now, but is called Equator. And Equator is a network that provides the checklists and details explanation on how the quality of different types of study designs would be evaluated. And so a little trick is to actually use that checklist for writing your paper, because you'll have a specific study design. So you might have a prospective cohort study, or you might have a retrospective cohort study, or you might be writing up a scoping review or a systematic review. If you can go to Equator and it will tell you what the checklists are for those different types of studies, and it can help guide how to write a paper. They even now on Equator have checklists for qualitative research, which is amazing. Okay, so here is the International Committee of Medical Journals Editors document for the recommendation for the conduct, reporting, and editing and publication of scholarly work in medical journals. And so you can see the headings there. It also defines on who has the right to say that they're an author, with some responsibilities, goes over explaining copyright, fees. And then if you look on the right, section 4 there in Roman numerals, manuscript preparation and submission. And so that section actually goes over step by step about how to write a manuscript. general principles, reporting, and then it goes into detail into all those sections that I that that I reviewed. And these are the sections that a health or medical research manuscript is written in. So you would have your title page, if you see that, as the first page. Then the second page would be the abstract. Then the third section, which is usually about 2 to 2.5 pages, is the introduction. Then the next section is methods, which is about 2 pages. Then your results, which is about 2 pages. And then your discussion, which is about 3 pages. Then actually you would have an acknowledgement section on 1 page, references, and then the tables go after the references. And then the last thing to go are figures. And then you might actually have figure legends as the last section. So this is laid out in this recommendation paper, and we're going to walk through how to write a manuscript in this order. Okay. This is Equator. And so you can see how they'll have the reporting guidelines for randomized trials, observational trials, systematic reviews, even a study protocol. You can take a study protocol now and actually write it up and submit it for publication. Case reports, and quality improvement studies, economic evaluations. So, and there's even more types of studies that they have these guidelines for now. So check them out. So the majority of the types of studies we do, so for example, if let's say you want to write a paper using CHIWOS data, or you want to write a paper with BCC3. So what kind of study is that? So what kind of reporting guidelines would we use here? Shh. Sorry for the dogs. Does anybody know? They are observational studies. Okay. So they are cohort studies and observational studies. So you can see here that if it's a cohort study like CHIWOS, where that's forward in time, here is another sort of checklist of how the manuscript can be written. You might be doing what's called a cross-sectional study. You might be doing a cross-sectional study, which we do a lot, which is the collecting data with one time point. And so the sections for the paper are pretty the same, and the guidelines that we're using is called STROBE. And some actually journals will ask you to submit a STROBE checklist. Okay, that's a bit of background. Step 1 that I always do is I try to find a journal first that you plan to submit your article to. And I like to find the journal first, because every journal has different instructions. So if you have the instructions, you can start your Word document following the instructions rather than writing it and then having to edit it at the end. So how do you decide which journal you want to submit to? If usually you've done a literature review already on your topic, and what you can see is the articles that you're going to discuss in your introduction and your discussion. Sometimes you'll see like a pattern where one particular journal has published like quite a bit on that topic. So it could mean that they have an interest in that topic. So That's actually a common way that I choose a journal is where has prior literature been published. And then we also have our go-tos that we like to publish in. So like AIDS Care is a common journal we publish in. There is the International Journal of STD and AIDS, HIV medicine, and then there's also there in terms of picking the journal, there's also this concept of, I'm not sure if you've heard of impact factor, where a journal could have a higher impact factor, and so it's considered a better journal, and so you can try to get your manuscript in a journal with a higher impact. Um, and sometimes in academia, you're pushed to do that, to submit to high impact journals. And I don't totally agree with that. What I agree with is like my thinking about picking a journal and the impact factor is I'd rather aim for the right level and the right journal the first time, because if you submit it and it gets rejected and you have to submit it to a different journal, then you have to look at the instructions and change everything, if that makes sense. So, let me know if you have any, like, you probably have an idea of what journal you're thinking of. Um, and if you don't or you have any questions, um, let me know. Um, and actually a little trick, if you pick a journal um that has published on the topic before, when you submit your journal, you write a cover letter where you say, I'm submitting, this paper entitled this, that's on this topic. We looked at new knowledge that advances the field related to this, and then you can actually reference prior manuscripts that they published in the cover letter. Like you can say, this is a topic that you routinely publish on, and have some references, um, because then their papers are being referenced, which increases their impact factor, if you see what I mean. Um, um, what I do is the instructions are usually on the website. Sometimes there's a PDF. I copy them and put them right on the first page of my Word document where I'm going to be writing the paper. And then um and then after each section there might be instructions. So for example, the title can only be this long. Then there's something called the running title, which is like a short title, can only be this long. And then the authors have to be in a certain format. There might be maximum number of tables, there might be a maximum number of figures. So putting all of those instructions. Similarly, the abstract usually will have instructions what the maximum word count is. And then is it a structured abstract or just a free-flowing abstract? And then there might be a maximum number of word count for the main text. And so being clear on that, the usual sort of length of a medical or health research paper is 3,500 words. Um, and and nobody really wants to read a manuscript that's too long. So you should aim definitely for below 4,000 words. 3,500 words is kind of like the sweet spot. Some journals, their instructions that are the papers have to be less than 3,000 words. So that's like AIDS Care. So that makes it a little bit harder. And just for you like to have some concept of what that means is there's about 250 words per page, because you submit the paper usually using a font like Times New Roman or maybe Arial, and you have to double space the format. you double space it and it's left justified. So when you double space it, it's about 250 words per page. Another thing I do before getting started is if after I've picked my journal, is I look through that journal and I get like examples of papers that have already been published, so I can kind of see how the format is that they like their papers written in, if that makes sense. Okay, any questions about that, about choosing a journal? Anybody?
Oh, how do you find out what that factor is, whatever it was called, where you
Impact factor?
impact factor?
Yeah. Well, you can probably just put it in Google, put the journal, and then ask what the impact factor is. You might be able to ask in ChatGPT. But if you press the journal and you go to like their homepage of any journal, they usually or should have the impact factor on their homepage. It'll say impact factor. Okay, it should be on their homepage. And you'll see it, and it may be there and you didn't know what it was, but it should be on their homepage of every journal. And basically, like most of the journals we would publish in, because we have such like a specialized topic, would be around a impact factor of 2 or 3 or 4. And we would be lucky if we had an impact factor of between 5 and 10, and anything above 10 is just considered like unbelievable. So like those would an impact factor greater than 10 would be like the New England Journal of Medicine, Lancet. Um, the highest impact factor journals are like more basic science, health and medical journals like I think there's one called Science, there's one called Cell, and then Nature. You may have heard of Nature. So those have like impact factors of 20 or 50. So yeah, so because our area is so specialized, don't get hung up that the journals we publish in, the impact factors are a little bit lower. If the impact factor is less than 1, it's considered low, but it doesn't matter to me. I think that every paper has the right fit and has a home in a journal. Yep, there was another question.
I think you answered it, but I was wondering for people like us who are, I think most of us are students, or we're not really, I don't think any of us are considering like tenure track positions where, the quality of, I mean, not the quality in terms of the quality of actual paper, but where they're published are that important. But I think my question was, how important is the impact factor? Because some like open access journals, I believe, have a lower impact factors, and considering the ethics of, trying to, not put your paper behind a paywall because they're in a way, I don't know, restricting access to science. Would you say essentially is, I think what you said was if it's below 1, then that is maybe too low. But other than that, what I take away from what you said is that it doesn't really matter that much. And it may, like, depending on personal preferences, it may even be better to publish an open access journal. So I just want to know your opinion, and like, is there any source of consensus on that?
Yeah, I think open access is always preferred. I'll explain what that is to everybody. So I think it's about 25 years ago, um, um, that some editors from one of the higher journals were unhappy or thought it was unethical that all the manuscripts were behind a paywall. So the first open access journal was PLAWS. It's called PLAWS. And uh and there's PLAWS 1, there's PLAWS Medicine. Um so um and basically the idea is Actually, PLAWS has like academic editors. So like I was an academic editor where you're sort of supporting each other, sending them out to reviews. And it's like a great concept, like the idea that everyone can access your paper. So I'm very pro open access. We have to have open access if we get CIHR funding. Most public funding need open access journals. The problem with open access now is that you have to pay for open access, and it's so expensive now. It's like it's not uncommon that the open access would be like $3,500 US. So that's like $5,000. Or there was another one we saw the other day that was like $4,300 US. So, $7,000. So like to me, that's like that's the amount of money for an internship. And so I would prefer to give that to a person rather than the open access. So that's a bit of the problem I have right now with open access. So if there's an open access journal where the amount paid is like around $1,000 or less, I'm okay with that. There is one. It's called JIAPAC, the Journal of International um uh a- uh the International AIDS Physicians um um association. So that's one that we also publish in. So I have a love-hate relationship with open access, if that makes sense, mainly because of the cost. And then like now it's been 25 years of open access, and imagine like you're paying like $4,300 US for open access. It maybe comes to a point like, are you actually buying your publication? So that's like another sort of interesting thing to think about with open access. So if you can get open access, especially if you can get open access and the fee is waived or lower because you're a student, try to do that. But what we can do because we're at U of T is if it's not open access, we are allowed after the copyright allows after 1 year, it can be uploaded on the university repository and can be accessed that way. So I hope that's helpful. And then the other thing, like for what I sort of say to people who are applying for academic positions, is at first it's for your job, you're more concerned about quantity of manuscripts than impact factor. So you'd rather aim low or right and get those publications out. And for like a assistant professor position, I would say you'd be looking at, you'd really like to have, I'd say 10 plus publications. So it's really quantity at first. I hope that's helpful. The other thing in terms of which journal is like, I know you're saying you don't know which one. You can run it by your supervisor or your team for recommendations. And we usually pick like, okay, this is going to be like for our first choice. And then we often will have second or third choice if it doesn't get accepted at the first one.
Thank you.
Okay. Okay. Okay, the next thing I do, okay, this is just going to show you how I'm a real procrastinator. And it is a little bit hard to write manuscripts because you need undivided time. You need like a good 2, 3, 4, 5 hours of undivided time to write. So if you only have like an hour, hour and a half, this is what I do. And this is like procrastinating. I call it starting with all the fluff, which is like you have your Word document, or you might have like a prior manuscript that you could use as a template. And I do all the parts of the manuscript that like don't need any writing. So like I do the title page, because we have our title, and then you have to put all the authors on the title page, which doesn't really take a lot of brain power, and you have to have a corresponding author. It's all in the instructions. And then you'll have the next page will be abstract. And I don't, I just leave it blank. And then on the abstract page at the bottom, they usually ask for keywords. So I put those. Then on the third page is introduction. I write introduction. But I add in I do like a page break and do methods, and then results and discussion. I write all the headings without any content. There's often a request for disclosure page, funding, and acknowledgement. I write those. Those are pretty easy. So you can see that now I have like what I call is like kind of like a skeleton of the paper, but really you haven't done that much. So then, so now now you have your skeleton and you've done your title page. Your title page is complete. So, and the second page is the abstract. I write it as the header, and I write in brackets what's the word count. And then you have to figure out what the format of the abstract is. Is it just is it free text, or do they want it structured, which means like background, methods, results, conclusion? You can look at the journal at other papers in that journal. I find that helps with the abstract. So I've changed how I do abstracts. A lot of people writing manuscripts leave the abstract to the end. And actually it was an editor of British Medical Journal, BMJ, that taught me this trick. So especially, let's say you're writing up your master's thesis or your PhD thesis. You already know all your results. So actually, if I know all the results, what I'll do now is I'll write the abstract first, because the abstract is technically, in my mind, is the most important part of a paper, because the editor might just read your abstract and decide whether to send it out for review or reject it at the editorial level. And if you write your abstract first, and when you write a paper, you're trying to tell a story. Okay, and your story goes, the introduction is this is why this topic is important. This is what we know about it, but this is what's missing. So our objective is this, and then these are our methods. Here are our results. And then the discussion is, look how great the findings are that we found. And this is how it compares to prior literature. This is how this impacts programming. This is how it could impact policy. Here are our limitations and conclusion. That's the story you're telling. And your abstract should basically have that same story. And so usually they're about 250 or 300 words. And if you have all your results, I recommend writing your abstract first, because then it really guides your writing of your text. And so I do that now. And because sometimes if you leave it to the end, you kind of like rush through your abstract. But really, please don't rush through it. It's really important. Okay, next you're going to probably write your introduction. But the problem with the introduction is that um, you can get stuck with your introduction. So you could like start writing your introduction, and it takes over, like you keep writing and writing. It's kind of like the background of a grant. You can like start with the background, and the grant's only 10 pages, and you've like filled your 6 pages of background. So if you're that kind of person, I recommend starting with your methods or results. Otherwise, write your introduction, title, and be really clear on what the maximum word count is going to be of your introduction. There's no point on overwriting in terms of word count for your introduction. So usually I'm going to do the calculation here. For a 3,500 word paper, your discussion would be the longest. So let's say about your discussion would be like about 1,000 words. So, and then So that leaves 2,500 for the introduction, methods, and results. And so I just did the calculation. That's about 830 words per other section. So do you see that? So you have your introduction, but you know that it really shouldn't be more than 900 words. And same for your methods and your results, and your discussion is longer. Um, so I think now I do start, well, actually, I do like to start with the methods and the results and then go back to the introduction. But if you don't have your results yet, starting with the introduction is useful. So, and there's a formula for how you write your introduction to a manuscript. Again, the first paragraph is, why is this topic important? Like, what is the topic, why it's important? And sometimes what I do is write sort of the paragraphs like in bullet form, like what I'm going to put in the first paragraph, like what's the topic, why is it important? Then your second paragraph is, what have other key papers written about this topic? And then a third paragraph would be, well, and what's missing from the literature? And you will always end your introduction um, saying what the purpose or objective of this analysis or manuscript is. And you know, the exact paragraphs might, and the bullet forms might be like a little different for each paper, but this is sort of a good format. I sort of write often bullet points for each paragraph, and then I start writing the sentences. Um, and sometimes when you write the introduction, you can get really caught up with your references. Um, so another trick to writing your intro is, rather than really getting stuck with references, um, is to just write freestyle. Like, you've already read all your references, so you know the literature. So just write freestyle, do the bullets, and then write the sentences, and then write your introduction, and you can go back and do the references instead of getting like caught up with your references. That's a little trick for the intro. Any questions about the introduction? And then remember, in the introduction, like, you're setting up your story. Now your methods, methods, I like to do, like, you know, page break for each section. So for the methods, um, you can, even if you don't have your results yet, you can usually start writing your methods with the subheadings, which are typically, what is the study population, you might write study population and design as a subheading, then description of your outcome, then your other variables of interest, statistical analysis, and then ethical considerations. And sometimes some journals like ethical considerations to be put above study population. So usually you can actually start writing your methods, even if you don't have your results yet, because you know them. Okay. Um, so if you feel like you don't know your methods well enough, you can leave the skeleton. Like, you can leave the heading methods, and then you can do study population and study design and put XX experts blank. Then, you know, outcome, description, variables of interest, description as a subheading, XXX. You might have, and then statistical analysis, and, you know, leave them blank. You can write your research ethics sentence. And then you're going to move on to your results. And we're going to talk about, and then so I do like a page break, write results, and the results will be written, where is it? Your results will be written, your results will be written, the first section of the results is like a description of the study population. So that's like the first section, study population. I don't have that well explained here. And you need to describe what your study population is. And you're going to have tables and figures. So the table 1 is always the description of the study population, either as a whole, or it might be divided by the outcome, or it might be divided by the variable of interest, and compared. So table 1 is always the description of the study population. And you might ask, like, how do you know what to put in the text of the results and what's in the table? So what's in the text is like telling a story about the study population. And then the tables is a visual representation. And so most of the table 1 is in the table already. So you don't put every variable in the text. You just put the highlights. And tables and figures should be able to completely stand on their own. So in a table, you'll have a title, so like table 1, and then you'll put your table, and then you'll have footnote at the bottom, outlining each if you have abbreviations. But a table and a figure with the title and the footnotes should completely be able to be understandable without reading the paper. And then so you'll have the study population with the description, and then again, oh, here, yes, I did write it. Same, the subheadings are the same as the method. Study population, then usually you'll have your primary analysis, and then you'll describe that, and there might be an attached table or figure, and then you'll describe maybe your secondary analysis. The results section written out is usually short, like it's usually only, like, let's say 500 words, because you also have tables and figures that you're summarizing your results with, if that makes sense. So you don't put all the items that are in the tables and figures in the text written results because it's too repetitive. So that is the results. And then I find the most difficult part of a paper to write is the discussion. So you cannot write the discussion until you have your results. So it's possible if you don't have your results yet, look at what we've done. We've done the title page. You can't write the abstract. You can maybe write the introduction and the methods of the abstract, but you can't write the results and conclusion. But you have your title page, you have half your abstract, you have your introduction, you have your methods done, what you don't have is your results and your discussion and your tables and figures, but then you have acknowledgement, and disclosures written. So that's not bad. You have about half your paper written already. And you don't even have your results yet. Okay. You have to have your tables and figures and your results before you write the discussion. So the tables you'll probably write with the analyst together. It'll have a title. So table 1 is sociodemographics explanation. It's sociodemographics of the study population. And then you'll have the variables in the rows. You might have overall, and then by outcome, for example. And then usually table 2 will be a summary of your primary analysis. And then you might have a figure, and then you might have a table 3 or 4 with secondary analyses, and similarly figures. One mistake that happens is sometimes if I review a paper, people forget table 1 needs to be a description of the study population. So that is like a red flag, and will be written in the reviewer comments. And then, and again, with the title of the table and the figure itself, or the table and the footnote, like in a figure, there's a figure legend with the title, but you put a footnote explaining what's in the figure. That should be able to stand alone. So a person might actually just look at the figure and should be able to read all that and understand what the figure is saying. So once you have your results section done, you have your tables and figures done. Um, Often the figure legend, which is the title of the figures and the footnotes, the journals want them on a separate page. And you can like put them last on in the paper. Like you do page break and you write figure legends and you put those in. Okay. Okay. So um often it's the statistician you're working with that would make up the figures. Unless you've done your master's and you've done the analysis yourself. Okay, so now to me, writing the discussion or any questions about the introduction, the methods, and the results. No? Okay, I hope it's clear. I find when you come to write your discussion, you need your results and your tables done. And this is the part that I find the hardest, but that I actually find the most rewarding, because this is the creative part of um, writing a manuscript. Although actually coming up with, how you're going to do your analysis could be creative also, but um, your discussion is actually the creative part. So the first paragraph of the discussion is the summary of your findings. Okay. So I wrote here, this is like the third most important part of your paper. And that's because um, consistency is really important. So you have your abstract, which I think is the most important part of a paper. Oh, and paper and manuscript, those two words are synonymous. Okay. They mean the same thing. So if I say manuscript or if I say paper, they mean the same thing. So your abstract's the most important part of your paper. And then the second most important part is actually the last sentence in the introduction, which says the objective of our analyses the objectives of our analyses are, and what you write there needs to be consistent with what's in the abstract and what you're doing in the methods and the results. And then the first paragraph of the discussion summarizes your findings and your message, and it has to be consistent with your abstract and the last sentence of your introduction. And so that's another sort of flag as a reviewer when a group, an author group, hasn't put a summary of their findings in the first paragraph of the discussion. Then your second paragraph, like what I usually do is compare it to other papers in the literature, and then you comment on, like, compare it to other findings in the literature, but maybe how you found something different, or it corroborated what was in the literature, but this was new. And you might even have 2 or 3 paragraphs about that, sort of summarizing each area of the analyses you did. And then, um, and then, um, then it's often then you have 1 or 2 paragraphs sort of thinking about how your findings impact policy and programming. And then you always need a limitations paragraph. It's the second last paragraph in your manuscript, and it's another sort of flag that a lot of authors forget. And if there isn't one, as a reviewer, we would write, you need to add a limitations paragraph. And there's always limitations like um, uh, enrollment bias, like so for example in Chivos, the women who enrolled in Chivos potentially we're a particular group of women more engaged in care. And so there's a bias, an enrollment bias, because we're potentially not enrolling women who are not engaged in care. So, we have to limit that. Also in CHIWOs, the limitation is it was a survey. So people had to remember. So that's like recall bias has to be commented on. So maybe they don't recall properly. There's also CHIWOS was interview administered. So that also can be can present bias where the participant, wants to please the interviewer. And so gives sort of different answers to please, or doesn't want to say the truth, for example. Um, because they're embarrassed or something. So you sort of summarize those limitations, and you might comment on how you overcame those limitations. And then your last paragraph of your discussion is a concluding paragraph, sort of very briefly re-summarizing your findings and talking about your next steps, or what you would recommend as your next steps. And then you write that. And if you haven't completed your abstract, you then have to go back to your abstract. And often you have to go back to your abstract again at the end, just to make sure that it is consistent with the rest of the manuscript. And don't forget, like, spend time on the abstract to make sure that it's the best possible, because it's so important. And then congratulations, you're done. You've written your first draft of your paper, and you can circulate it to co-authors. Usually we allow 10 working days for co-authors to review and provide feedback. Sometimes, there's feedback and you have to do extra analyses, but hopefully not. Right, when you send to co-authors to review, it's best to give a date that you want the feedback by, and then send a reminder a couple of days before that, please, can you give feedback by this date? Sometimes people are 1 or 2 days late, so you have to sort of build that into your timeline. So then you get the feedback from the co-authors, you enter that in, you finish your manuscript, you do your references, which most people do in Zotero now, and you have your final version. Voila, and you can submit it. I don't think you need to send a second draft to co-authors for re-reviewing, but that really depends on, like, if the first version had a lot of edits and you want sort of more feedback, you can, but I don't think you have to. And then when you submit it to the journal, you have to make an account in the journal, and then you have to enter in usually the authors in. You have to upload a cover letter, and then you upload the manuscript, and then every journal is a little different. Most of them want the tables and figures in the draft with the text, but some of them want them separate, so you have to follow the instructions. Um, and then um, sometimes they want the authors and the institutions to be anonymous. So sometimes they make you do what's called an anonymized version of the manuscript, where you remove all the co-authors. And so, for example, you would remove names like that might be recognizable, like CHIWOs or like Women's College Hospital, and you put in quotations anonymous. So in case the reviewer knows you. Um, I find that kind of annoying, but that is what's sort of asked more and more. I see I have spelling mistakes in this presentation. Sorry about that. Any questions, final questions? And then we'll stop the recording, and we can like go over any specific questions about your papers. Okay, sounds like we'll do that now.